I want to start by thanking everyone for joining us this afternoon. My name is Antonella Giancarlo. I'm a Senior Communications Officer with the City of Hamilton, and I'll be moderating this media briefing today. Before we begin, I'd like to first start by apologizing that we're beginning a few minutes after scheduled, so thank you so much for your patience for waiting. I also want to let everyone know that we are recording the media briefing today, and it will be posted on our website after the fact. I'll ask everyone who is not speaking to please stay on mute until you're called upon, just so we can avoid any background noise. Media are asked to keep their questions today to the topic of pest control complaints and inspections. Excuse me. To confirm, the spokespersons available to answer your questions today and to provide remarks are from Hamilton Public Health Services and are Dr. Elizabeth Richardson, the Medical Officer of Health, Kevin McDonald, the Director of Healthy Environments, and Matthew Lawson, the Manager of Health Hazards and Vector-Borne Diseases. With that, I would like to turn it over to Dr. Richardson, who will provide some opening remarks. Dr. Richardson, over to you.
Thanks very much, Antonella, and thank you to all of our media partners for joining us this afternoon, though I regret the circumstances that have brought us here together. In a media report that was published yesterday on Hamilton Public Health Services' reduced level of pest control investigations since the onset of the COVID-19 pandemic, comments by Public Health Services staff minimized the importance of this important issue and the significant duress and discomfort the presence of pests can have on those who experience infestations in their home. I do want to offer an apology on behalf of the City of Hamilton and Hamilton Public Health Services for these insensitive comments. I know the staff person who made these comments, who is here with me today, Matthew, deeply regrets the lapse in judgment. I know Matt did not intend to cause any pain to those who have suffered as a result of pest infestations, but the fact is that these comments have caused pain. I want to apologize as well on behalf of the City of Hamilton, as well as Hamilton Public Health Services, to those in the community who felt that our level of service for addressing pest control complaints was not up to their expectations. The COVID pandemic provided unprecedented challenges for our team's ability to continue to provide all of the critical public health services and programs that Hamiltonians continue to rely on and trust. We take our responsibility very seriously to protect and strengthen the health and well-being of all residents in Hamilton. Beginning in March of 2020, Hamilton Public Health Services paused the majority of our programs and services in order to redeploy staff to support Hamilton's unprecedented emergency response to COVID-19. The level of service for pest control complaints did change, whereby our public health services staff continued to respond to complaints and provide educational resources, but pest control inspections were put on hold. Over the past year, Hamilton Public Health has been reopening services that were put on hold, as well as addressing the backlog across many of our programs, including our vaccination programs, our dental screening programs for children in school, our dental treatment programs, as well as inspection programs. And we know other areas also had to curb service levels. We appreciate that these are important programs that Hamiltonians have come to rely on. In terms of numbers, for reference, Hamilton Public Health Services received 1,064 pest control complaints in 2019, the year before the pandemic began, and all of those were investigated by staff. Since the beginning of the pandemic in March of 2020, 301 complaints have been logged over the past 3 years and actioned by staff with educational supports, and this includes 186 in the past year. Ultimately, each and every complaint is coming from a member of our community who is looking for support from Hamilton Public Health with the presence of pests. As we work to reopen our inspection programs, which include our pest control complaint inspections, Public Health Services, in cooperation with our licensing and bylaw service colleagues, we look to improve upon our previous model and bring in a dedicated resource that could address both the pest and property standards issues that often go hand in hand. This dedicated officer begins this Tuesday, August the 8th, and will be in the field as soon as possible. More resources are being contemplated as part of a review that is looking at how the city could do broader inspections on rental apartment properties. The resource that is starting on Tuesday is, as I said, is an officer. He is a bylaw officer. They are a bylaw officer who will focus exclusively on pest control. In addition to any new complaints that may come in, we're also going to be reaching out to individuals who have previously made complaints. We again want to apologize for any comments made that may have made it seem that we do not take this issue seriously, as well as to any individuals who did not feel well served during this change in service during the pandemic. The health, well-being, and safety of our community members remains our top priority. And I'm going to turn it over now to Matt Lawson, who'd like to say a few words.
Thank you, Dr. Richardson. Pardon me, folks. I've been with Hamilton Public Health Services for close to 21 years. I started in this role with a strong desire to make life better for residents in Hamilton and have woke up each morning since with the same strong desire. I take the health and well-being of those in Hamilton very seriously. That's why I'm here today to extend an apology to those who felt pain based on my comments in a recent media story, minimizing the negative impact pest infestations can have on community members. My comments were a lapse in judgment, and they don't in any way reflect my continued commitment to the people of Hamilton. The presence of pests can be extremely uncomfortable and distressing. Pests can affect people's physical and mental well-being, including the potential for allergic reactions, infections related to scratching, as well as anxiety and insomnia stemming from the distress in having to deal with pest infestations. Our office remains committed to working closely with our colleagues and partners in municipal law enforcement to assist residents experiencing pests in their homes to find solutions and be free of the burden of having to live with them. Thank you for listening to me today.
Thank you, Matthew, and thank you, Dr. Richardson. With that, we will now go to members of the media for questions. I'll note that we do have a hard stop at 5, but we'll begin with one question and one follow-up, and if time permits, we'll move to a second round of questions. So with that, our first media partner is Lisa Pileski from 900 CHML. Lisa, please go ahead with your question.
Hi, thanks so much for taking our questions this afternoon. Just was looking to find out was it the media article from CBC Hamilton that kind of sparked this investigation into what's been happening with pest control, or was this on public health's radar prior to that article?
Thanks very much, Lisa, for the question. And no, this has been on our radar for some time as we, what we do when we do emergency responses, we do categorize all of our programs and services and look at them and had to go deep into the pausing of programs during the pandemic. But we keep reviewing that list and trying to make changes and do what we can all the way through. And certainly that was renewed when we were able to start reopening programs at the end of last year and have continued on and looking at how can we move forward, what can we do to do it better, what lessons have we learned as we've gone through the pandemic about what would make our service better. So this, along with the pest control efforts, along with all of our program services, have been being reviewed as we go forward. And this approach that was developed to do this work with hiring a municipal law enforcement officer to do it as well as we could, streamline the efforts that would be put out there instead of having to involve 2 officers that often is the case when we have these kinds of complaints. That's been something we've been working on for some time, as you can tell by the fact we have somebody starting on Tuesday.
Okay, thanks. And guess my follow-up would be so this officer that's starting next week, that's obviously a good step, but there's probably that it's the sheer volume of complaints I'm sure that are existing across the city. Are there any plans to add more than this particular person, or is there going to be maybe some sort of task force going forward, or is that something that council would have to decide?
Right. I think, you raise a lot of good questions, and that's what we're looking to see. Since over the past 3 years, we've certainly had a significant reduction in the number of complaints, down to 186 in the past year versus over 1,000 prior to the pandemic. And so, as we move forward in understanding the issues that are out there, we do have some opportunities with this upcoming report around departments looking at how do we move forward. And so you'll see that be coming forward during the meeting cycle in August to talk about where are we going with these issues. And so our colleagues in planning and economic development are bringing that piece forward. And I think that conversation is going to be ongoing about, what are the level of issues that are here. This person will definitely be collecting some information, and doing the follow-up will help us as well. And then looking at how do we move forward. But I think it's really important to continue to underscore there are things that people can do today, working these issues through. There are things that landlords can do today in terms of working with pest control companies to ensure that these issues are addressed. There are, of course, open to people, landlord, tenant, kinds of resolutions to issues, but those are things people can do today, and then we'll look at how enforcement and inspections continue to play a role as we move forward.
Thank you very much. Samantha Beatty from CBC is also with us. Samantha, please go ahead with your question.
Yes, I wanted to ask, in our previous interview, you shared a few more details about streamlining efforts, which would include kind of skipping maybe a site visit and talking to the landlord and getting receipts and proof that they'd hired a pest control company. I was wondering if there's any concerns that this approach, while it would speed up the process, might miss the tenant's side of the story and the tenant's evidence. So is this something that's on your radar? How are you going to address that?
Matt, do you want to go ahead?
Sure. Yeah, thank you, Samantha, for the question. I don't think I was giving a complete, that suggestion was not a fully in control idea. That was just a suggestion at the time to say that once the inspector does come on board, they will be going through an orientation period with health inspectors who have traditionally done that work. And they'll be working together to try to find ways to make inspections more efficient, knowing that we're going to likely have a good number of complaints out there where people are going to want to have service provided. So that suggestion was not anything to suggest that there will be shortcuts or incomplete effort applied to the investigations. The investigations will still need to have minimum criteria, such as there's evidence that there's an infestation, and listening to the client. That's going to be part of it, is where the client will be contacted for their side of the story to understand, where can we help you? Is it about information that you're seeking, or do you need an enforcement? And if it is, if they're very quick to identify something where it might save some time and it's not fully an enforcement, but rather it's a consultation, that's, I think, what I was referring to in that first interview that we had. I don't know if that helps get to the answer.
Yes, thanks. And sorry, I'm just kind of, Dr. Richardson, you mentioned that there are other resources that public health is considering to kind of bolster these efforts depending on how it goes. Do you know, like, what other things are you looking at to help handle, like, maybe a high volume of complaints?
Yeah, thanks, Samantha. I think this is, part of what's going to be the ongoing discussion. At this point, we have resources that are available from an educational perspective. We've got information on the web. People can call and talk with people. We are going to have this bylaw officer who's in place that can begin to get a handle on where things are today. We're going to have more discussions about this issue at council this coming week, 2 weeks, to talk more about the broader issues with apartments and how does this all fit in and how can people work together, so we have as sort of comprehensive and streamlined approach to issues. So I think that's going to be an ongoing discussion, or that is going to be an ongoing discussion as we move forward with the issues. And so I think these are we're putting in action the ideas we've had today to improve the service, and we're going to continue to look at what can be done.
Thank you very much. I believe we have Sue McDonald or Samantha Lawson from CHCH. If you have a question, please go ahead. I think it just might be a live feed. I'm going to move along. Sebastian Borne from the Hamilton Spectator. Sebastian, please go ahead.
Hey guys, thanks so much for taking our questions today. I have one for Dr. Richardson. You mentioned at the outset of your comments about Mr. Lawson's statement to CBC, how it minimized the importance of the issue. I wanted to ask you, because I did some reading in our archives, and I noticed that in May 2022, in an interview with the Spec, Michelle Baird, the Director of Wellness and Communicable Disease Control told us that the decision to pause the pest complaints was because, and I quote, "There's no immediate risk to health." So, it seems like this isn't the first time that it happened. And if you're apologizing for this now because it's gotten more widespread attention, what do you say about the comments of old?
Yeah, thanks, Sebastian. I appreciate you looking back and bringing continuity to the story. That helps us all. I think, when Michelle was speaking, and I remember that time frame, I was off for a couple of weeks in there, and she was addressing those issues, and she was speaking to, the challenges we were having in terms of how did we manage to reallocate resources during, the unprecedented challenges of the pandemic, and that we were really down to prioritizing based on the things that were the most immediate needs. And so I think that's not inconsistent with what I'm saying here today. We know there's a number of issues. There are more issues than we can possibly deal with that lead to, physical health, mental health challenges. And, we're always having to look at how can we best use our resources to address those issues. And so while we were continuing to respond to the pandemic, there were difficult choices that had to be made. There were kids that didn't receive vaccinations. There were inspections that weren't done in some other premises as well as we moved forward with these issues. There's a lot of chronic disease work that wasn't happening. Tobacco control issues, like these are all important issues that face our community each and every day. They're ones that we would want to serve each and every day, be able to serve and make people's lives better. But unfortunately, there were choices that had to be made. There were limited resources that we had. We had a very difficult time in terms of recruiting and retaining people as we went through that to the levels we needed. We had almost doubled the number of staff that we had on board with us, and we're still looking for more. And so, those comments reflect the challenges we were dealing with in that day, and reflect how we've been, the comments today as we move forward are around making sure people really understand we do consider these to be important issues, that we are doing our best to reopen things, that, on this occasion, we did not speak about these in the way that we would want to. We want to make sure that it's clear that we do understand how important these issues are to people.
Mm-hmm. Just before I get to my follow-up question, so I have it clear what, and I know you can't speak for Michelle, but what you're saying is that, her saying there's no immediate risk to health, she wasn't necessarily talking so much about pests and pest control, but more so, relative to the other challenges at the time, like COVID, and things like that. Is that
No,
right?
exactly. Yeah,
Okay.
you've got that right, Sebastian.
Okay.
As I said, she was trying to put it in context of just how we were pushed on with very acute issues, and COVID was the primary one that day.
Yeah. The other question, and you may have answered this earlier, but these 300 odd complaints that have been logged by staff since the pause was in effect. I know you said that there's one bylaw officer who's going to be starting on Tuesday, but how do you approach these complaints given that they date back some 3 years? Do you deal with the ones that are most recent, the ones from the 186 from the past year? Do you start from the beginning? Are some of those complaints from 3 years ago, even still valid complaints in the sense that maybe the tenant or the landlord has stepped in and dealt with the issues themselves? How do you approach the number of these complaints, given that some of them are from a few years ago?
Yeah, thanks, Sebastian. And I think that's part of the issue, is that we definitely want to deal with ones that are active and are causing challenges today. And so with the complaints that come in are going to be dealt with, and we're also going to be looking back, and we'll start with the ones that are most recent, and see, where are people still having challenges? Have they been resolved? They've been able to get pest control in with the educational supports that they've been given? Have they been able to address things with their landlord? If it's a landlord issue, because some of these are related to landlords and tenants, and some of them are related to people in their private dwellings as well. And so we'll start working through, looking to see, are there patterns, are there things that we can find that can make going through those earlier? But we'll start with the ones that came in that first year, and go from there.
Thank you, Dr. Richardson. We have Crystal Deboo from In the Hammer in Saga. Crystal, if you have a question, please go ahead.
Oh, sorry. Sorry about that. Yes, I just want to clarify. So for that, the bylaw officer itself is the only one that's going to deal with all these complaints for now? The one that's going to start on August 8th?
Thanks, Kristen. Yes, that's the bylaw officer that's coming on. We normally had a half-time bylaw or a half-time inspector dealing with these issues. That was the amount of resources that was dedicated to this through the budget. And what we brought on to try and help with the catch-up is a full-time officer to help us on a temporary basis at a higher level of service, so that we can make some progress, both with new complaints coming in and with those from looking backwards, and then look at how this merges, as I said earlier, with other issues that we're dealing with, and how, you know, what are the resource levels that might be needed as we move forward, and speak with council about that as need be.
Okay, thanks. And so actually you're saying that before the pandemic, there was only a part-time officer dealing with this?
We were only funded to that level, and you know, where they could, where these overlapped with other issues that health inspectors were dealing with, they would try and help with addressing some of these complaints. But the resourcing issue is a significant issue. We certainly know these issues come in waves, and so, you know, we've seen waves come through, and at times the number of complaints is much lower when it comes to pests. But as we get a handle on it and where we're at now, with that high level that we saw just before going into the pandemic, we'll get a better sense of what the resources are needed going forward.
Okay, thank you for your answers.
Thank you, everyone. Before we conclude, we have Kate Stoller from KX 94.7. Kate, did you have a question? Okay, I think it's just a stream. So that concludes today's media availability. I do want to apologize. We only have the time to do one round of question and follow-up, but to all of the media partners here today, if you do require any additional information or have any follow-up, please don't hesitate to reach out to our media relations team, and we're happy to facilitate that for you. I want to thank Dr. Richardson and Kevin McDonald and Matthew Lawson for being with us today and answering the questions. And I want to thank everyone for making the time to join us today. As I mentioned, send any follow-up questions to mediarelations@hamilton.ca. And thank you once again for joining us today. I wish you all a pleasant evening.